The medical community often refers to it as the desperate housewife syndrome, an increasing number of middle-aged women seeking treatment for eating disorders. We often think of bulimia and anorexia affecting teenagers, but as health reporter Alicia Booth shows us, there are now more older women looking for help.
There comes a time in every woman's life when she has to take a long, hard look in the mirror and ask herself, what the hell is that?
You have to wonder if a woman who looks like that is having body image issues. Where does that leave the rest of us? The pressure to be thin is now for women of all ages, and that's
unbelievably damaging.
Mark Warren is a psychiatrist at the Cleveland Center for Eating Disorders. It's estimated 8 million people in the U.S. have an eating disorder, with the majority of patients teenage girls. National statistics on older patients aren't routinely kept, but Dr. Warren says in his practice he has definitely seen an increase in women getting treatment in their 20s, 30s, and 40s, and the media is not helping.
Almost no women on television are overweight, and if they are overweight, usually they're in a comic relief role. There's an overt message from programming that if you're overweight, there's something wrong with you.
He says most adult women getting help are not just starting to have problems.
Most eating disorders do develop in adolescence. So if you're seeing a woman in their 30s with an eating disorder, the odds are very high that they've been sick for quite some time.
A lot of people are living this life and nobody knows.
Stephanie Sizemore is now 30 years old and didn't start to confront her issues with food until her mid-20s. She kept them well hidden behind an all-American girl appearance, swinging back and forth from bulimia to anorexia. In her sales career, she felt rewarded for being thin.
Oh, you look so great. Or women especially, like, oh, I wish I had your body. I wish I had your arms. You know, how do you do it? It's like an eating disorder is your own prison. And some days, most days, it feels like you can't ever get out.
She spent years in that prison and wishes she had asked for help earlier.
If I would have gotten more in-depth treatment up front, I think that I would have recovered sooner or started that process sooner.
Dr. Warren says a teenager can see dramatic results from treatment in just a year. For an adult, it's more like 5 to 7 years. And those patients tend to have major responsibilities like family and career.
So for that person, they really have a very complex situation on their hands.
But the right treatment can work. Dr. Warren's clinic focuses on getting patients out of physical danger first, then moves them to intense therapy. The clinic also works with families to set up a support network. Stephanie, however, benefited most from an inpatient treatment program. And though she still struggles, because she got help, she's able to move forward, even getting married this month. She's also pursuing a career where she captures the beauty around her and worries far less about her own. Stephanie and Dr. Warren both say if someone wants to hide an eating disorder from you, they probably can. But look for changes in weight and eating behaviors and more conversations dominated by food or weight. We have a lot more information on this and where to get help on Newsnet5.com. On your side, I'm health reporter Alicia Booth.